Today we will learn about the music therapy. Music is what we love from our childhood. हर किसी को म्यूजिक बहुत पसंद होता है and music can be with us happy when we are upset. It can make us energetic when we are doing some sort of a party. So this music has a great history. In the 17th century, the scholar Robert Burton, The Anatomy of a Melancholy, urged that music and dance were critical in treating mental illness, especially a melancholia. He noted that music has an excellent power to expel many other diseases, and it called it a sovereign remedy against the despair and melancholy. So, in the 17th century, Robert Burton he founded that music can help us in treating a mental illness, and it has an excellent power. And I think you might have experienced this also. When you are sad, when you're feeling low, when you listen to music, what you love to listen, you feel good too after that. So, what a definition says music therapy is an interpersonal process in which the therapist uses a music and all of its facets physical, emotional, mental, social aspect and spiritual to help the clients to improve the or maintain their health. So music therapy is basically used for interpersonal process for the and it makes the person physically, emotionally, mentally, socially or spiritually to improve their mental health. This music will improve the person's individual's emotional health. It will help the individual to improve its mental or social or spiritual well-being. Next, the history or further history in the Bible, in the Samuel 10, it has described that large choirs and a orchestra. Prophet Samuel was the patriarch of a school which taught not only the prophets and holy men, or but how to, but also scare a right musician, boy David, and to King Saul. So in the Bible, it is described about the choirs and orchestra, which is used by the not only by prophets and holy men but also by other persons. Then history of music therapy has in the healthcare profession the first music therapy degree program in the world founded in the at Michigan State University in 1944. The American Music Therapy Association was founded in 1998 as a union of the National Association for the Music Therapy and American Association for Music Therapy. So the first music therapy was started in Michigan State University in 1944, and other histories are there. In 1959 to 1970, the first European music therapy training program were initiated is famous for the psychotherapy. So it helps in improving our psychological improvement. In 1970-1992, Alfred Stolmos held it that the hierarchy for music therapy for psychosomatic, pediatric, and psychiatric were established. And then in 1992-2003, psychotherapy based mainly used for psychodynamic and humanistic method and gave rise to several music university. From 2003, Australian University enables a master these new now in the future in PhD study of music therapy. So yeah, the story, the history directly reveals that music has a good impact on our mental state, and it improve our mental state, well-beingness, and it helps in the treating of various disease which is related to a psychological problem or a mental illness. What are the goals of the music therapy? So, improving the patient's communication skill, helping the patient to take their focus away from the grief or pain, improving the patient's ability to move, altering the patient's behavior, then improving the patient's social skills, allowing the patient to think creatively and develop their imagination, helping the patient to deal with the rehabilitative process. The goals of music therapy is simply improve the communication skill. First thing, helping the patient to take focus away their grief or pain. The pain is always makes a person sad, unhappy. He can't enjoy the his environment or her environment goodness. Then improve the patient ability to move. Move means to move from his uh, saddest part or the bad things of his or her life. Then monitoring the patient behavior, improving the patient's social skills, allowing the patients to think creatively and develop their imagination, helping the patient deal with the rehabilitative process. Importance of